Now, the United Kingdom, as we've been discussing, is going to be taking the first few tentative steps to easing its lockdown tomorrow. Nothing dramatic, of course, that we're expecting. But other countries have already gone further, reopening shops and schools. And pretty constant comparisons are often made to how different countries have handled the pandemic. So to discuss the pros and cons of the different strategies, we're joined now by Tarik Jasarevic, a spokesperson for the World Health Organization. Thank you for being on the programme. So different countries are starting to look at easing the lockdown, taking different steps. What do you think are the best strategies going forward?
Well, good morning. First, what we see that the state of outbreak is different in different countries. So obviously every country will look into the phase of the outbreak they are in and will make a proper decision. What we have said from the World Health Organization is that countries who are planning to ease the restrictions that have been in place should really follow some guidance, and that's basically to make sure that the transmission chains can be controlled, that public health system is ready to quickly test, isolate, and trace contacts of infected people, also to be able to cope with a possible surge in new infections. We also have to make sure that care home for home care for elderly people, as your guest was just saying, are also being protected, because we know that this is very vulnerable population that lives in these establishments. There's also to be really looked on a workplace and how we can ensure that some measures are being taken within the businesses, within offices. So we try really to reduce the number of new infections, and we also obviously need to have a population being properly informed and following the instructions. So eventually these restrictions, as they are lifted, will obviously help economies, will help society, and it will help people reconnect with each other. But we really have to be careful, because we know that this virus will stay with us for some time.
One of the big differences between lots of countries is what they're doing on schools and nurseries. Now, we know, of course, that children are much less likely to become seriously ill from coronavirus. But what's the information on whether or not they can spread it?
Well, there is a very limited information. So as you have said, we know that children are much less affected by the virus itself, but we know that they can get infected, although a very few number of children will go into severe phase of a disease. When it comes to children being spreaders, we don't have a lot of information. We don't have information that would suggest that children play an important part in spreading the virus. WHO has worked with UNICEF and other agencies to issue guidance to schools for them, as well as we were just saying about workplace, that the schools are also ready and try to minimize the risks.
We're going to be hearing from Boris Johnson later today about a roadmap for easing the lockdown in the United Kingdom. Given the level of infections in the UK, given the R rate, do you think it's important for him to proceed with caution?
This is the advice we gave really to every country, is to be very, very cautious when taking these decisions to ease down the restrictions, because really what we don't want to see is that there is a second wave and that we have to go back to the lockdown. That would be traumatizing, I think, for everyone. So it's important that this is done in a staged, in a gradual way, so we can really see what is the effect of people getting back close to one another. So it is really important that this is being done very, very carefully, so we avoid a possibility that we have to go back into situation we've been in.
There also seems to be growing evidence that I want to ask you about obesity and people who are overweight being more likely to have complications from coronavirus. Is that what you're seeing? And do you think there's even perhaps evidence suggesting that countries with higher death rates, such as the United States, such as the United Kingdom, may partly be because there are more obese people in those countries?
Well, we are still gathering evidence on many aspects of this virus. you will agree it's really new virus, and it's difficult really to generate reliable data in such a short period of time. So we are looking into all possible elements. But it's true that a person who has a healthy lifestyle, who has appropriate nutrition, who is exercising, who is not smoking, will have a stronger immune system. So this is the case for any disease, including the coronaviruses. So we, in any case, recommend people to try to have a healthy lifestyle, including a healthy diet. When it comes to deaths, we have issued guidance on what deaths should be attributed as a coronavirus, but this may vary among countries. There are also different testing policies in different countries. So therefore, we have to really take carefully these different death rates that we may see coming from different countries.
Now, there's been criticism, just finally, that China hasn't been open enough at the beginning of the outbreak about what was happening. There's been lots of distrust about some of the statistics and the figures that China has been posting as well. But the World Health Organization has, I guess, held back, really, in criticising China, even though they haven't allowed your investigators in there. Some say that you're a puppet for China. Have you been tough enough?
Well, we are a member states organization. We serve 194 countries, and we treat them in the same way, no matter they are big, small, rich, or poor. We work with the data that are provided by member states. We expect all countries to provide accurate data as much as possible, because World Health Organization is operating under international health regulations, and this document is being agreed by 194 member states. So basically, member states themselves, countries set the rules, and we expect them to go by those rules. China has been facing a new virus. Obviously, at the beginning of the new outbreak of a new disease, you will be testing people who present with symptoms. So it will be difficult to expect that there is an accurate number. And we should really look across the board, because countries have completely different testing policies right now. And some countries have been so much overwhelmed by the number of patients that the reporting was very difficult. So basically, what we were saying about China was that they did share genetic sequence of the virus quickly, and that helped all the countries to develop tests and basically to do the testing. They also did introduce very strong public health measures that helped them get the numbers down. But again,
can we trust the figures coming out of China? Many say we can't. Can we trust them?
I think really we have to look across the board. So what figures are really accurate if some countries, for example, do not test the population? So how can we have really accurate numbers? If some countries have, like Italy was dealing with so many cases inside hospitals, how they can generate really data, because the priority is to save lives. So I think every data we get is no data is perfect, let's put it that way. Data is information that helps us make best possible public health guidance, and this is what we do.
Okay. Problems, of course, though, if the data can't be relied on. But thank you very much for that interview. It's much appreciated. We're out of time, sadly.
Thank you.